Welcome to Coaching Healthcare Leaders, where we transform great physicians and healthcare professionals into exceptional leaders. I'm Dr. Lisa, an executive leadership coach dedicated to helping healthcare leaders navigate the complex intersection of clinical excellence and organizational leadership. My mission is to give healthcare leaders a voice to help build sustainable health systems where everyone feels valued, healthcare workers want to stay and grow, and patient outcomes improve. Each episode, we'll tackle real challenges faced by medical leaders like you, provide actionable strategies, and feature live coaching sessions with healthcare leaders. Let's grow together. Hello, everyone, and welcome to the Coaching Healthcare Leaders podcast. I'm your host, Dr. Lisa, and today I have with me another amazing guest, Dr. Ghanshyam Toshkezi. And Dr. Toshkezi is the Clinical Director of the Department of Neurosurgery at Meredith Medical Center. So welcome to the podcast.
Thank you for the invitation, Lisa. It's my pleasure to be in your podcast.
Yes, absolutely. So I'm always fascinated with the field of neurosurgery. So I can't wait to get into this discussion with you. My first question is just share with us a little bit about your career journey. How did you arrive at your current situation? And then who or what may have been instrumental in that decision?
My journey is a long journey. I graduated in University of Tirana in Albania, and I did my first residency in Paris, France. There, I decided to come to United States, thinking that I had the experience, and I wanted to challenge myself and to become a neurosurgeon in the United States. Initially, I did not know about the difficulties to be a neurosurgeon in the United States, and that's a good thing I didn't know because probably I would have not done it. So I arrived here in 2005 with a tourist visa, with a luggage with personal items and the American dream to achieve. And then I realized the difficulties. It was very competitive. I did my test to get into the field of neurosurgery, and still it was competitive for a foreign graduate. So in the beginning, I thought that it was easy, and then I realized day by day, and the days became months, and months became years, until the opportunity came. I did my fellowship initially at the Boston Medical Center as a foreign doctor in neurosurgery. I worked day and night. I did a lot of cases and surgeries, and I gave it all to show people that I have a value and I deserve to be in this field. Then I got into residency in upstate New York, State University of New York in Syracuse, where I redid my training. And I worked harder because I wanted to show people who gave me the chance that I have values and I deserve to be in this field. And also I wanted to show the other people who down the road told me and they did not believe in me in the beginning that they were wrong. So I worked harder for that. I worked harder because I wanted also to show myself that I like this field and the decision that I make to come here was the right decision. I finished my residency. I started assistant professor at Thomas Jefferson University. And after 5 years, the opportunity was to have this position of leadership, clinical medical director of neurosurgery at Meredith Medical Center, which is a center that is growing with the medical school, and the Department of Neurosurgery is growing with the great neurosurgeons and healthcare providers.
Wow. I mean, what a story of grit, determination, resiliency, all of the things. So congratulations to you. That's a wonderful story that you're sharing. And we have, something in common. I also attended Upstate as a medical student though, but so we're both alumnus of, Upstate Medical Center. So
Small world.
small world, exactly. Yeah, so that's a wonderful story. So tell us a little bit about, sort of what your role looks like, as a medical director of neurosurgery at your current institution. What does that role look like? Who do you serve? What's your day-to-day like? And, what challenges do you face?
So first, I'm a neurosurgeon, so my basic day is to take care of my patients, to see patients in clinic with problems of the brain and spine and peripheral nerves, to operate on the patients when it's needed, and to worry for their outcome and to have great outcomes for this patient. They are my priority.
Hmm.
And then also, it's my responsibility to first make sure that the team and building the program at Meredith Medical Center with my colleagues, neurosurgeons. We are in the process of hiring and expanding our team with other neurosurgeons. We have healthcare providers, PAs, physician assistants, and nurse practitioners, and all the stuff. And beside being a neurosurgeon and taking care of my patients, also it's my responsibility to make sure that the work and the teamwork is good, it's provided there, and we all together we can provide care for our patients and the community around that needs help.
Yeah.
So I think I try to make smooth the collaboration between the team members, to lead them by example, and to provide a healthy environment, working environment.
Yeah. That's wonderful. What are some ways that you think that you kind of lead by example?
Number one is to do my job well, to take care of my patients and to show them that my values as a neurosurgeon, my passion as a neurosurgeon translates in good results,
Hmm.
patient care. That's, I think, number one. Second is to be there when it's needed, uh, give myself and my energy to uh, work hard, long hours, to be present and to help the other team members when they need me, to show them that I'm there for them when they need me.
Yeah. Yeah. That's so important, showing up for team members. So I'm sure that your environment, invites the right people, but also, also creates a great culture for people to work in, which is evident by the fact that you're expanding and you're looking to bring, more people in. So congratulations on that expansion and the work you're doing there.
Thank you.
Yeah. So, in your current role, tell us about how the work that you're doing, directly impacts patients in terms of the communities that you serve.
So my patient comes to see me because they have a problem, neurosurgical problem.
Hmm.
It might be a tumor in the brain, it might be a brain bleed, hemorrhage, a trauma, traumatic injury. It might be a chiari malformation. It might be a degenerative disease of the spine, with back pain, neck pain, arm and leg pain, and weakness. So, as a neurosurgeon, it's my job to diagnose properly the problem, and then to make sure that we put the right indication for neurosurgical intervention. And the job goes farther. I make sure to do the right neurosurgical intervention and to have a good outcome for my patients. So that's the most important part in my daily job, to make sure that my patients are happy and they are taken care of with the best care possible.
Yeah. Yeah, absolutely. So thinking about, some of the challenges that we face in healthcare, right? Because, we know that in some areas there's a shortage of healthcare providers. We also know that sometimes there's access issues, for patients. What are some suggestions that you might have in terms of ways in which we can deliver better care to our patients?
I think the healthcare you mentioned, in this current situation, has three components that I believe the three components are not happy with the healthcare system that we have.
Yeah.
On one side, we have the insurance and administration, which they take care of the business part of it, and the money and the investment. and they want to make sure that the investment and the money is spent correctly, and they want to make sure that it's not spent a big amount of money and wasted. On the other hand, you have the doctors and healthcare providers, which they need to do their daily job. And for that, they require probably some investment and some money to be spent. And that creates a conflict sometimes between the administration and the insurances and corporation on putting pressure on the medical doctors and medical providers to do their daily job.
Right.
And that makes them also unhappy sometimes. And the third component, and the most important probably, is the patient care. Patient today, they already have a problem when they come to the doctor and the healthcare provider. And the least thing they need to worry is about the insurance and the payments and all that, which at some point it comes to their attention.
Right.
And beside the main problem, which is the health problem, it adds more to their problem. And that can make them also unhappy. So in the current situation, I think we have three components that also, they are also probably making each other happy and they're unhappy. And I believe that healthcare reform needs to be done in the way that all three components are happy. They help each other and they don't conflict the situations. And that's in the interest of all three components.
Yeah. Yeah, that's a good way of looking at it. Because all three components are important, right? And we can't overlook one for the other. So we do have to find a way where it serves all three, right? So it serves the business side so we can stay operating. It serves the physicians and the providers so we can continue to take care of patients and not burn out and leave, and then also that we are impacting patients with the best care. So yeah. Yeah, so thank you for sharing that perspective. So you talked about, like, in the beginning, your journey and some of the adversity that you had to obviously face, some of the challenges you face with coming here and starting your neurosurgery journey, and then ultimately in the position where you are today. So there may be a lot of people watching this, physicians and non-physicians, who might be sort of facing the same sort of adversity, maybe in a different way, but some adversity along the way. What advice would you give them in terms of how to thrive in the face of those types of adversities?
So my advice from my experience, my past experience is, first of all, you got to understand yourself, your strength and your weakness, and you got to put out there the best of you, your strength.
Mm.
Second is, do not give up. If you believe in yourself, you got to persist on achieving your goals. You have to find the right environment. You have to be supported by the right people, and the right people don't come by chance or by accident. You got to attract that environment. You have to be in those environments. And also, it's important, there are people who, they don't believe in you, not because they don't like you, but they don't know you, they don't know your strength, they see only your weakness. Those people are important too, because the moment you believe in yourself, you work hard to tell people that believes in you that they are right, but you work harder
Mm.
to tell the people who didn't believe in you and they saw you weak, to show them they were wrong. And that's a satisfaction. It's a double satisfaction at the end of it, because at the end you show yourself who you are, and you achieve your dreams.
Yeah. And I think you're so right. There are people who, will not believe in you, right? And I always look at it, and sometimes will tell, my clients as well, to not take it personal, because it's not personal.
Right. That's very important. There, you need people like that in life. You need people to tell you that probably you are not as strong or as valuable that you think you are, but of that probably is a wake up call to
Mhm.
make sure that you can find your strength and you correct yourself.
Yeah. Yeah. So it's really important to operate from that space of knowing, like you said, yourself, knowing who you are, and then knowing what your strengths are is so important. Yeah. Yeah. So thank you for sharing that. So how do you as a neurosurgeon, because I can only imagine that, you still sometimes have long days and long nights, right? Long surgeries, you're dealing sometimes with a lot of patients who are debilitated. So how do you, in all of that, find time for yourself? And what does that look like?
Um, I think it's important to have a balance in life. So first of all, I see myself uh, as a human being who
Mm,
has responsibilities in life to take care of your patients and to do your job well. Of course, the job requires a lot of time and it's a big investment from
mhm.
yourself, requires your energy and your time and to put your work in it. And that is day and night and
Yeah.
stuff. And we have a say between us. It doesn't get easier. It just you get used to it,
Mm,
the job that you do. And then you have the mechanism of adjustment. You adjust yourself to the long hours working and hard work, but you sleep when you can. You eat when you can. You
mhm.
take care of yourself when you can, because you know that any moment you may be needed. They can call you for an emergency. And at that point, you don't think about yourself anymore. You think about your job and someone who's in need.
Mhm.
You leave everything else at that moment. But the moment that you have that small time, free time, and then you enjoy them, you try to enjoy it to get the most out of it. Uh, Thinking about taking care of yourself, your family, kids, and your friends that surround you, and that makes it more complete. Your life when you
Yeah.
know how to find that balance and know how to dedicate your time to each part of it, each component.
Mhm. Yeah, absolutely. Absolutely. So what is one thing that you found joy in that you like to do outside, of your busy practice?
So I lived in different countries, and one of my joy now is to continue to travel and explore the
Mhm.
world if I have the time. But even for 1 or 2 days, for me, it's like connection with the nature and the new places that I want to explore.
Yeah.
That's one of my hobbies. I like to take care of myself physically, go to gym and to run. That's important for my physical health and for also remove the stress that is accumulated from work and from the daily activities. I like to read a lot. I have a passion for languages. I speak four of them, and I'm curious to know. I like history. I like geography. I like to explore.
Yeah. That's great. So we do have another thing in common. I do like to travel as well. So even if it's just like you mentioned for 1 to 2 days, just getting out doing something different, seeing a different part of the world or, yeah, just being out in nature. So
It's healthy physically and mentally, and it creates a better connection of you and the surrounding and the world.
yeah, absolutely. Absolutely. Well, thank you so much for sharing your journey with us. I learned so much about you. Very fascinating. I can't wait to share this with everyone. Do you have any parting words that you have for us at all? Anything that you want to share?
Um, Thank you so much for this opportunity. I enjoyed the conversation with you. I want to tell everybody to see their strength and to give the best of themselves in this world when there's competition. But there is also a lot of kindness, and there are a lot of great things out there to reach out and try to make yourself happy always.
Yeah.
your hard work and your achievements.
Yes, I love that. Make yourself happy. Thank you so much again for joining us on this podcast. I'm looking forward to staying connected. And where can people find you? Are you usually on LinkedIn? Is that where we can follow you?
I'm on LinkedIn with my name, Dr. Gentian Toshkezi. I'm on Instagram, Dr. Gentian Toshkezi, Facebook as well.
Okay, wonderful. So I'm going to make sure that I follow you on all those platforms as well.
Thank you. I appreciate it.
Okay.